So, cholesterol is a fat like substance that is created by the liver, as well as it can come from our food. And it serves as a precursor for bile, steroid hormones, and vitamin D. And they are packaged into lipoproteins, which are used for the distribution of cholesterol into tissues. So, lipoproteins are essentially an assembly of lipids and proteins, and they're classified by their density. So there are two types of lipoproteins. There are low density lipoproteins, which are typically your bad lipoproteins, and then we have our HDLs, which are our good lipoproteins. So here we have our bad one, here we have our good one. And the lipoproteins, which contain more lipids, are typically larger in size. So LDLs are typically larger than our HDLs. And then on the other hand, the lipoproteins with a higher density have less lipids and more proteins, our HDLs. And the protein structures that are on our lipoproteins serve as essentially a tag that tells the lipoprotein where to go. So, for example, the LDL is going to take the cholesterol from the liver and distribute it back into our peripheral organs, away from the liver to the peripheral organs. And then on the other hand, we have our HDL, which is going to take the cholesterol away from peripheral organs and then back to the liver, essentially cleaning up what LDL did. So the pathway of cholesterol is going to start in our liver and then it will end up in the peripheral organs, which we'll go through. So dietary and endogenous made cholesterol plus triglycerides are going to be packaged into something called VLDLs, which are very low density lipoproteins. And these VLDLs are going to travel into the bloodstream to organs where muscles and adipose tissue can then extract triglycerides from VLDL to then turn it into something called LDL, which is our low density lipoprotein. And LDL is then going to be taken up by cells using endocytosis, where cholesterol can then be used inside of the cell. And this excess cholesterol is going to be exported from the cells, delivered to our HDL molecule to then return back to the liver, which is something called reverse cholesterol transfer. And the liver can then use it to make bile, which is going to be used for the breakdown of fats, which is then excreted in the feces, or it can be recycled. LDL also has the highest cholesterol content in the body, and it is the major carrier of cholesterol in the blood. So as LDL travels through the bloodstream to deliver cholesterol into the cells that need it, your body can accumulate too much of it, so it can build inside of the walls of the arteries, which can then become oxidized, sometimes referred to as ox-LDL. And this oxidation of LDL is recognized as a damaged substance by macrophages. So the macrophages are going to try to engulf this oxidized LDL and they'll become full of it, which will then make them turn into something called a foam cell. And these foam cells will continue to accumulate, forming early atherosclerosis lesions that will then turn into bigger plaques, unfortunately narrowing the artery walls, and that can lead to some potential cardiovascular event, such as a stroke or a heart attack.